male fetus, and it has an extremely long half-life, which is 5 weeks. So it takes a month to clear the drug once dosing has stopped, and it suppresses the production of the DHT by 93%. Some adverse effects are reduces ejaculate volume and libido in some men, causes decline in PSA, inhibits the development of external genitalia in the male fetus. So it is rated category X by the FDA pregnancy risk category. It can be absorbed through the skin, so pregnant women should not handle this drug. And men should not donate blood while taking it, or for 6 months after, just to avoid giving blood to a pregnant woman. Dosage and administration is 5 milligrams once a day, taken with or without food, and treatment continues indefinitely. Alpha-adrenic antagonists. There's 5 approved for BPH. Alfuzoin, terazoin, doxazoin, sulfadozin, and Flomax. Mechanism of action is a blockade of alpha-1 receptors, which relaxes smooth muscle in the bladder, neck, prostate capsule, and prostate urethra, thus decreasing dynamic obstruction of the urethra. Symptomatic improvement and increased urinary flow develop rapidly. It's preferred in men with mild prostate enlargement, and it must be taken for life. Receptor specificity and impact on blood pressure. Sildosin and Flomax are selective for alpha-1 receptors in the prostate. They're a benefit to men with low BP. Alfuzoin and terazoin and doxazosin block alpha-1 receptors in blood vessels as well. This promotes vasodilation and lowers blood pressure. It's especially useful in patients who have hypertension, in addition to BPH, but it's dangerous for men who have hypotension. Some adverse effects. Alfuzoin, doxazoin, and terazoin cause hypotension, fainting, dizziness, somnolence, nasal congestion. Sildosin and Flomax causes abnormal ejaculation, ejaculation failure, reduced volume, and retrograde ejaculation. Drug interactions. With the non-selective alpha blockers, alfuzoin, doxazoin, and terazoin, you need to use caution with other drugs that also lower blood pressure, such as organic nitrates like nitroglycerin, antihypertensive drugs, strong inhibitors of the dosage and administration. For doxazoin, you can start with 1 milligram once daily to a max of 8 milligrams once daily. And terazoin, start with 1 milligram once daily at bedtime to a max of 10 milligrams once daily. Alfuzoin, treat with 10 milligrams once daily, start right after a meal. Sulfazoin for men with normal renal function, it's 8 milligrams daily with the same meal each day. And for men with severe renal impairment, this med should be avoided. Flomax, you can take 0.4 milligrams once daily, 30 minutes after the same meal. Other drugs for BPH include salpimeno, which is an herbal preparation used to treat BPH. Extract prepared which is extract derived from ripe berries of the American dwarf saw palmetto. Detrol, which is muscarinic antagonists developed for urge incontinence, and when used alone in combination with Flomax, it can improve urinary symptoms associated with BPH. And Botox, which is a single injection into the prostate, can relieve urinary symptoms for up to a year. Benefits derive in part from blocking the release of ACH from neurons that innervate the urinary tract of smooth muscle. And that concludes.